there are still some physicians who are at fence for performing radial access for peripheral interventions. Part of their concerns are because we don't have all the devices available to perform these interventions very successfully. I would like to tell them that most of these interventions can be performed very safely from the radial access. And also the industry is coming out with different products which will allow these procedures to be completely performed through radial access. Also, there have been studies that have come out that have shown the safety and the efficacy of these products through the radial access. And the biggest advocates are the patients. When the patients get these procedures done, they come back happy, and for them, the trauma of a groin access and a groin closure is not there. So I really feel for all these physicians that patient care is getting better by performing radial access.